Alright, so these hair loss treatments, both prescription and over-the-counter, are proven effective to work for both men and women who are experiencing hair loss or hair thinning. Hey guys, kumusta kayo? And welcome back to my channel. If you're new here, my name is Moe and I do contents about nursing in skincare and hair care. Alright, so first, let's start with the prescription medications, okay? So first one being oral finasteride 1 milligram. So guys, finasteride 1 milligram is proven effective for male pattern baldness as it blocks the conversion of testosterone to DHT or dihydrotestosterone, which is a very strong hormone that attacks the hair follicles, causing hair thinning or hair miniaturization. So if you're on your early stage of male androgenetic alopecia and you still have, active hair follicles, I would say that this drug, guys, works like miracle. You would definitely see an improvement within 3 months, but of course, a much better result with prolonged use. Oral finasteride does come with side effects such as erectile dysfunction and low libido. So make sure that you always talk to your doctor for in-depth information about this. Next, we have the topical finasteride, okay? So those who are concerned with the side effects that are associated with oral finasteride, you may want to consider topical finasteride. So the topical form may exhibit lesser side effects, but the efficacy is sometimes questionable. If you're on your aggressive stage of androgenetic alopecia, the topical form may not be so beneficial. I would still recommend that you take the oral form first and wait until your hair loss has settled or lessened. Then maybe you can shift to the topical form slowly. This way, it wouldn't be too much for the topical finasteride to block those DHT on the scalp as it was already lessened systemically using the oral form. So in regards to the dosing and frequency of topical finasteride, this is based on your doctor's assessment and evaluation. But overall, topical finasteride is also an effective treatment for androgenetic alopecia. So next is the use of Dutasteride 0.5 milligram. If in any circumstances, finasteride 1 milligram is not effective for you, your dermatologist may prescribe you this medication. Dutasteride is another DHT blocker which blocks type 1 and type 2 dihydrotestosterone and blocks 90% of these enzymes compared to finasteride, which only blocks type 2 DHT. However, guys, as of now, Dutasteride 0.5 milligram is not approved for hair loss as its main use is for benign prostatic hyperplasia. So just like any other DHT blockers, it also comes with side effects such as erectile dysfunction and low libido. Dutasteride 0.5 milligram is another very effective treatment for hair loss where you will see an improvement in your hair in less than 3 to 4 months. So guys, both finasteride and dutasteride should be handled with caution as it can cause teratogenic effect on a developing fetus. A pregnant woman should not handle this medication and should not even crush it. So I did a video about cutting finasteride 5 milligrams into 4 pieces. In that video, I talk about what to do when you cut finasteride, the proper frequency, and how to handle this medication when you're cutting it. Alright, so next one, we do have oral minoxidil. Oral minoxidil is an antihypertensive medication which helps to lower blood pressure. However, they've noticed that patients who are on this medication were growing hair on other parts of their body. This came about the use of a topical minoxidil. Oral minoxidil may be given in low dose depending on your doctor's assessment. So in just 12 weeks, you will notice an increase in hair growth and with prolonged use. Take note, guys, that oral minoxidil causes a vasodilating effect, which in turn can cause dizziness, increased heart rate, and a drop in blood pressure. So oral minoxidil is more convenient in compared to topical form as you just have to, pop it in your mouth without taking too much time in rubbing it on your scalp as it is on a topical form. So next we have Spironolactone, which is another effective medication to treat female pattern baldness. So this medication is used to treat high blood pressure secondary to heart failure. However, this medication is used to lower those androgens that contributes to hair loss in women. 75% of women that are on this medication sees an improvement in their hair in just 4 months. Just like oral minoxidil, this medication lowers blood pressure, and so you may experience dizziness, increased heart rate, and dehydration, as it is also a diuretic medication. Again, dosing is as per your doctor's assessment and evaluation. So if you guys are interested in learning more about spironolactone for female pattern hair loss, check out my video on spironolactone, an effective treatment for female pattern hair loss. Alright, now let's talk about those over-the-counter treatments, starting with medicated shampoos. Guys, there are no specific shampoos or conditioners for hair loss. However, there are medicated shampoos that may help with keeping your scalp free of debris and helps treat inflammation. So the use of shampoos and conditioners with salicylic acid ingredient helps to get rid of dead skin cells, keeping the scalp clean, allowing the hair to grow better without obstruction. Zinc pyrithione ingredient as well as ketoconazole 2% helps to treat those yeast that cause dandruffs. Specifically with ketoconazole 2%, this is a very effective treatment for those yeast called malassezia that causes seborrheic dermatitis that causes dandruffs. Ketoconazole 2% may also block those DHTs on the scalp, as recent studies shows. So when using these medicated shampoos and conditioner, it's very important to lather it properly and let it stay on your scalp for 3 to 5 minutes before rinsing it. In this way, you're getting the most back out of it. So I've done a video on medicated shampoos for healthy scalp. In that video, I shared some products that I recommend that will definitely keep your scalp healthy and may help with hair growth. Last is we have topical minoxidil. Okay, so in contrast to oral minoxidil, topical minoxidil will have slower effect, but it is also very effective to promote hair growth. So both 2% and 5% minoxidil are effective for hair loss. However, I do recommend that you use the 5% since the dosage is higher, it'll work faster. And guys, with 5% minoxidil, as for some, they experience lesser side effects such as irritation. There are higher dosages of minoxidil such as 6% and 15% as I've seen in the Philippines. But guys, before you use something that's beyond what's approved by the FDA, please consult your doctor first just to be safe. So there we go guys with another nursing and hair care. I hope that you guys enjoyed and learned something. If you guys have any questions or suggestions, feel free to leave it in the comment section down below. Follow me on my Instagram and Facebook page, and as always, never self-diagnose. Seek medical help for proper treatment and diagnosis. Anyways guys, magkita-kita ulit tayo on my next video. Bye-bye!